Diabetes self-management education and support is a standard of care, but there are inequities. There's a pressing need for quality diabetes education and support that reaches high-risk communities. For our populations, they often don't have the knowledge or the facts about the self-management. But even once you have the information and you know what it is you're supposed to do, what's far more difficult is how you actually do all of those things and do them for a lifetime in the context of everyday life. The Decide Self-Management program is designed to bring to high-risk populations effective diabetes self-management training that changes behavior and improves clinical outcomes.
Decide is a 9-module structured curriculum, and what it does is it walks participants step by step through problem-solving training so they can incorporate self-management into their everyday lives. The first module is called All the Facts, and it's really focused on disease self-management education. It takes clinical guidelines and translates them into clinical facts that then help the participants translate that into active self-care behaviors to hit their targets. Modules 2 through 9 then walk you through the step-by-step, identifying what are the barriers and challenges, and then how can you plan to overcome those barriers and challenges to meet your targets.
Decide facilitators play a key role in helping our participants gain the essential skills and knowledge they need in order to problem solve the challenges that come up every day when managing diabetes. People who are Decide facilitators can come up from a broad range of backgrounds. They can be laypersons or they can be healthcare professional.
The Decide team closely collaborates with different organizations to ensure that there is optimal implementation of the program based on the organization's goals, the target population that they're trying to reach, as well as their resources. So we provide consultation as well as ongoing support. We provide training, fidelity monitoring. We even help teams set up their evaluation and analysis plans. And we also help them to think through of how to maintain or sustain the Decide program long term.
We reach people right where they are, in the communities where they live, work, and age. And so community-based organizations and faith-based organizations, departments of public health, employers, all of these organizations are able to deliver Decide right in their settings.
We find that it's important for our facilitators to come from the organizations that are delivering the Decide program. So these lay facilitators who are part of that organization often have a connection to the community, and they understand the unique challenges that are faced by that community. And so they have a personal connection that allows them to engage with participants in a special way.
We all know that diabetes continues to be on the rise, and people with diabetes, they need assistance beyond just going to the regular 15 minutes of fame with their doctor. And so the Decide program is an opportunity for them to get all the facts related to diabetes, cardiovascular disease, and the complications associated with diabetes. And so the Decide program provides them what are those self-management behaviors that we need to address to help you to be compliant with your diabetes care. As a facilitator, my role is to lead discussion to help people identify those needs, what's getting in the way of them being the best manager of their diabetes care.
It's a program comparatively that's not about just teaching you. It's about managing your day-to-day problems and challenges and issues and how you go about doing that. And it also brings in an area that I'm real familiar with, and that's the power of group dynamic, to encourage you to change your habits. And when you have a group that are sharing their problems and issues together, it's very helpful.
Decide has multiple delivery formats to meet the needs of individuals and organizations. So Decide in person is delivered by a trained facilitator and can be conducted in a group or one-on-one. Decide is also available virtually. Again, a Decide facilitator leads the sessions live, Participants can log in to a virtual telehealth or virtual platform and receive the sessions that way. And then there's also a self-based virtual opportunity as well, where participants can actually log into a website and complete the modules on their own.
We are proud that Decide has received national attention and recognitions, including a Telly Award for health and wellness education. We've received a Fullwood Foundation Award for service to the community. And Decide has received a U.S. Surgeon General's recognition under the Obama administration for our physical activity program content. In addition, Decide is an American Diabetes Association recognized research-tested diabetes support program.
The Decide program is changing lives, and it's helping people to be able to manage their health, particularly people who otherwise do not have good access to care or sometimes go unseen and unheard. And this program is about empowering people to improve their health long term.